Hello, CMWL network providers. This is Dr. Matthew Pinto, CMWL's medical director, bringing you more information you can use in the diagnosis and treatment of obesity in your practice. We are really living in an exciting new era of obesity care. The recent availability of once-weekly injectable GLP-1 weight loss medications like semaglutide and tirzepatide have proven to be a game changer in helping patients lose weight safely and quickly. And it's likely medication's efficacy will only continue to improve. In this segment, Dr. Aparna Chandrasekaran, or like I like to call her, Dr. Chandra, a doctor on the forefront of obesity medicine advancements, will walk through another fascinating area of obesity care. Genetic testing has proven to be an extremely effective resource in the areas of prevention, diagnosis, monitoring, and treatment of a vast array of conditions. As you'll learn, this includes obesity.
I'm Dr. Aparna Chandra, the Medical Director of Jersey Medical Weight Loss Center and Clinical Advisor at Center for Medical Weight Loss. I'm very excited to be presenting on the topic of genetic diseases of obesity, intriguing facts and promising tests. Disclaimer: this presentation is for educational purpose only. It is non-promotional. I do not represent Rhythm Pharmaceuticals and not being financially compensated by them for this presentation. All slides were provided by Rhythm Pharmaceuticals as a professional courtesy. We're going to be starting with the basic. As we all know, obesity is a disease of increased fat mass associated with risk to health. Genetic factors play a significant role in determining one's weight. Heritability studies suggest that majority of variance in BMI may be attributed to genetic causes alone. As you can see in this picture, environmental factors increases the likelihood of obesity in a person with genetic predisposition. A single gene variant can result in severe obesity. Rare genetic diseases of obesity. We have come to know some more information about MC4R pathway dysfunction, that is melanocortin 4 receptor pathway dysfunction. When there is a dysfunction in this pathway, it leads to the genetic diseases that you see on the right-hand side of the slide: POMC, Leper, Bardet-Biedl syndrome, etc. The feeding behavior is very much controlled by the brain. The brain gets the signal for satiety from the adipose tissue. There should be an energy balance to maintain a body weight. The energy intake should be equal to the output. When there is an imbalance, that is when the energy intake is greater than the output, it leads to weight gain. The MC4 receptor pathway is a complex neurosignal pathway in the hypothalamus. I'm not going to go into the detail, but just to summarize, the adipose tissue secretes leptin. Leptin crosses the blood-brain barrier and acts at various receptor level in this pathway. The melanocortin 4 receptor pathway controls the hunger, satiety, energy expenditure, all these affecting one's body weight. When there is a receptor deficiency, the leptin is not able to act. Hence, the brain does not get the signal of satiety. So the person continues to eat, leading to hyperphagia and severe obesity. Screening for rare genetic diseases of obesity. Why is it important? Early diagnosis of rare genetic diseases of obesity is essential for optimal disease management. Understand the impact of these diseases. Internalization of weight stigma can negatively impact a person's physical and mental health. Identifying the patients is key. Genetic testing and early diagnosis of these rare genetic diseases aid in the management of the disease. Manage the disease with a multidisciplinary team. All these three important components will prevent the long-term health risks and improve quality of life. The characteristic features of rare genetic disease of obesity are early onset severe obesity and hyperphagia. These two are the common features of all these rare genetic diseases. They do have unique identifying features also. The characteristic features again are early onset severe obesity, the obesity starting before the age of 5, and hyperphagia. So we're going to be discussing in detail about hyperphagia in the next slide. Characteristic behavior of hyperphagia is very unique. It is peculiar. It is not the usual increased hunger, craving, and binge eating that we see in other patients. It is heightened and prolonged hunger, insatiable hunger, longer time to reach satiety, shorter duration of satiety. The moms frequently reports that the child has to be fed very frequently. Severe preoccupation with food. Food-seeking behavior that is very abnormal. Stealing food from others, they go to the extent of looking for food in the trash can. Parents frequently have to lock the pantry and the refrigerator to prevent the children from overeating. It is that bad. Significant functional impairment and emotional distress when the food is denied. The range of BMI in these children is also very high. As you can see in this graph, compared to the control group, those with MC4 receptor pathway dysfunction frequently have BMI above 95th percentile, most often above 97th percentile for the age. I'm going to be talking about 3 important rare genetic diseases of obesity. One of them is POMC deficiency. POMC deficiency is a genetically identifiable, non-syndromic, rare genetic disease of obesity. POMC is propionmelanocortin deficiency. Is an autosomal recessive inherited disease caused by variant of POMC gene. The key features are early onset severe obesity and hyperphagia. Other characteristic features include accelerated growth, red or orange discoloration of the hair, light or pale skin, hypoglycemia, and endocrine abnormalities. The other one is LEPR deficiency, that is leptin receptor deficiency. Is a genetically identifiable, again, is a non-syndromic, rare genetic disease of obesity. It is autosomal recessive inherited disease caused by the variant of LEPR gene. Clinical features include early onset severe obesity and hyperphagia. Other characteristic features are hypogonadism, hyperinsulinemia, frequent infection, and hypothalamic hypothyroidism. BBS or Bardet-Biedl syndrome is a syndromic rare genetic disease. Unlike the other genetic diseases, this is a syndromic disease. It is caused by the variant of BBS genes. The clinical features, again, are early onset severe obesity and hyperphagia. The hallmark symptom of BBS are visual impairment due to rod cone dystrophy, polydactyly, hypogonadism, renal anomalies, cognitive impairment, in addition to severe obesity and hyperphagia. Other manifestations include speech impairment or speech delay, developmental delay, diabetes mellitus, dental anomalies, LVH or congenital heart disease, brachydactyly or syndactyly, mild spasticity, strabismus, cataract, astigmatism, ataxia, anosmia, hyposmia, polyuria, polydipsia, hepatic fibrosis. BBS can be diagnosed with clinical presentation alone, and treatment can be started without genetic testing, unlike other rare genetic diseases of obesity. Genetic disease testing can only give additional information, or I should say it provides additional information to confirm the diagnosis. But it is a disease of clinical diagnosis. Guidelines for diagnosing rare genetic disease of obesity. The take-home message from this presentation I want is if you see a patient with early onset severe obesity and hyperphagia, please screen them for these rare genetic diseases of obesity. Identifying the patient with red flags with severe obesity starting early on the life and hyperphagia, in addition to neurological impairment, cognitive impairment, and significant family history of obesity. Genetic testing can aid in the diagnosis. As I had mentioned before, the genetically identifiable non-syndromic disease like POMC, LEPR, etc., they need genetic testing for diagnosis. Whereas BBS can be diagnosed with clinical presentation alone. Uncovering rare obesity. It is important to get to the root cause of obesity. Not all causes of obesity is due to environmental factor alone. Clinical guidelines recommend genetic testing to inform the diagnosis and also to start appropriate intervention for those with early onset severe obesity and hyperphagia. Genetic testing can be an essential tool in obesity management. According to the 2017 guidelines released by Endocrine Society, they suggest genetic testing in patients with extreme early onset obesity, that is starting before the age of 5, and with clinical features of genetic obesity syndrome, in particular extreme hyperphagia and family history of extreme obesity. The Obesity Medicine Association also have similar recommendation. Uncovering Rare Obesity. This is a program run by Rhythm Pharmaceutical. It is a no-charge comprehensive genetic testing program for rare genetic diseases of obesity. The program offers genetic testing, digital report access, as well as counseling services. Genetic testing, how important it is. Genetic testing can aid in the diagnosis and can help you and your patient find out the root cause of the obesity. It can help you with the possible diagnosis, start appropriate disease intervention, and also many patients might be eligible for clinical studies, which can be a game changer for them. And patients and their family have a great sense of relief once they know there is a genetic cause, or they feel the weight to be lifted off the shoulder when they know there is a reason why the child is acting that way and gaining weight. Connecting the dots. More than 80 genes have been associated with obesity, mostly in the MC4 receptor pathway. As I've mentioned throughout my presentation, the common symptoms are early onset severe obesity, the weight gain, rapid weight gain during childhood with a BMI greater than 95th percentile for the age, and hyperphagia. About 7% of childhood obesity are due to these rare genetic diseases alone. Uncovering Rare Obesity Program. The website for this is uncoveringrareobesity.com. To be eligible, they should be a resident of the United States. And for children 18 years and below, the BMI should be 97th percentile or above. And for adults 19 and above, they should have a BMI of 40 and above and with a history of childhood obesity. Immediate family members of the selected patient are also eligible for testing. And again, BBS, it will provide additional supportive diagnosis. Gene panel. The gene panel, which was initially 40 genes, have been expanded now to 79 genes and one chromosome region. So the patients who have previously tested will benefit or may benefit from retesting. This is not a test for Prader-Willi syndrome. So the full gene panel, when you get the report, looks something like this. The program. So the program for uncovering rare obesity is run by Rhythm Pharmaceutical, whereas the testing is done by Prevention Genetics, a accredited clinical lab. Once you order the test kit, the kit will be sent to your office. They can also even send the kits to your patient's home. You can collect the sample by either blood or buccal swab. After you collect the sample, you will send it to them and the results will be available online, and also a hard copy will be available, will be sent to your office in approximately 3 weeks' time. So it doesn't stop there. The Uncovering Rare Obesity program also gives a wide range of resources to you as well as to your patient. For your patients, they are eligible for 2 sessions of counseling with a genetic counselor free of cost. These are the 3 simple steps to get you started. Order the test kits at uncoveringrareobesity.com. Collect the sample, submit and track the test results at rhythm.preventiongenetics.com. So I'm going to share this slide with you. These are the phases of people living with rare genetic diseases of obesity. To conclude, screen patients with for rare genetic diseases of obesity, especially if you see the red flags, that is early onset, severe obesity and hyperphagia. or not all causes of obesity are due to environmental factors alone. Early diagnosis and treatment dramatically improves the outcome. The knowledge of the root cause of obesity can be a game changer in the management. There is FDA approved medication for PBS, clinical trials, or in progress for many others. Multidisciplinary approach is key. Uncover rare causes of obesity and discover a new path. Thank you.
Thanks so much, Dr. Chandra, for your expertise, dedication, and passion for sharing your knowledge. I hope you all enjoyed this segment as much as I did.